Steroids, medications that are often prescribed in cats. Dare I say, sometimes overprescribed? And the reason for this is because they do so many different things within the body. So let's chat about the good and bad of steroid use in cats, when we use them, and potential side effects that may occur. Hi everyone, I'm Dr. Oz. There are many synthetic steroids out there: dexamethasone, triamcinolone, methylprednisolone, but today we are focusing on Pred. And to be clear, when we say Pred, we really should mean prednisolone, not prednisone. Here's why. Prednisolone is the active form of the medication, the one actually doing the work in the body. After prednisone is absorbed by the digestive tract, it has to be converted by the liver into prednisolone. Cats aren't very good at absorbing prednisone, and cats' livers aren't great at converting prednisone into prednisolone, especially when compared to dogs and humans. So, if we want reliable results, prednisolone is the way to go and should be the only form prescribed to a cat. When do we use a steroid? Steroids affect almost every cell in the body, and depending on their dose, their actions can be very different. We reach for a steroid when we need to reduce inflammation, calm an overactive immune system, support a cancer treatment, or reduce blood calcium levels. Sometimes steroids are used just for a quick fix, like with an allergic reaction, flea allergy dermatitis, or a swollen lip. However, their use may be long-term for conditions like asthma, allergies, inflammatory bowel disease, or lymphoma. Side effects. The list is long. Here's the tricky part. While cats are surprisingly resistant to side effects of steroids, especially when compared to dogs and humans, they can still occur. Some common side effects you may notice include increased drinking, increased peeing, increased appetite, weight gain, vomiting, diarrhea, lethargy or decreased energy, dull or poor hair coat, behavioral changes like aggression, potbelly or distended belly, decreased wound healing, or muscle wasting. Just a quick side note, in case you were wondering why I mentioned muscle wasting or losing muscle mass in a cat that is on a steroid, that's because we're talking about a different steroid. Anabolic steroids that act like testosterone result in weight gain through building muscle mass. Prednisolone is a different steroid known as a glucocorticoid, which is similar to what the body naturally makes, a hormone called cortisol from the adrenal glands. It's also known as a corticosteroid. Even though there are a few synthetic steroids we can choose from, most of us just clump all of these medications, including prednisolone, into the same category and just say steroids. Now for the serious side effects that worry both veterinarians and cat parents. Secondary infections like urinary tract infections, diabetes, stress on the heart that can result in congestive heart failure or fluid buildup on the lungs, and gastrointestinal ulcers. Speaking of ulcers, there are a few big no-nos in veterinary medicine, and one of those is giving a steroid at the same time as a non-steroidal anti-inflammatory, an NSAID, which can result in an ulcer in the digestive tract. If this occurs, you may notice abdominal pain, vomiting blood, black tarry stools. That's an emergency and you should call your vet right away. When we need to be extra careful. Steroids should be used with caution in cats with kidney or heart disease, diabetic cats, young or growing cats, cats with high blood pressure, or cats with an active infection, whether that's bacterial, viral, or fungal. And because steroids interact with a ton of other medications, always chat with your vet about potential interactions and what to look for. If you miss a dose, it'll probably be recommended to skip that dose and give your cat their next scheduled dose. But you should always chat with your veterinarian about how to proceed. You should not give a double dose to make up for that missed dose. The balancing act. Sometimes life gets complicated. There may be 2 or 3 different diseases happening at once, and the rules for steroid use goes against the reality of what a cat needs. And this is the fun part of medicine. A perfect example is a diabetic cat that has another issue that requires a steroid. Steroids make insulin less effective. But what if a diabetic cat also has asthma or inflammatory bowel disease? They still may need a steroid. In these cases, we carefully adjust both medications until we find a balance. And once we find a balance, sometimes with a little trial and error, Many of these cats do pretty well even though the medications are working against one another. Monitoring and dosing. Once we determine steroids have a beneficial effect on a cat, the ultimate goal is to find the lowest dose that controls the problem. However, that dose may change over time as the disease progresses. Monitoring is critical with steroids. This isn't a wait-and-see medication. At minimum, full blood work and urine testing once a year. Ideally every 6 months or sooner if you notice a change in your cat. And one more important point, steroids should not be stopped suddenly, especially if your cat has been on them for a while. Because steroids suppress the natural production of cortisol, they have to be tapered down slowly to give your cat's body time to adjust to make its own cortisol. Your vet will guide you on how to safely taper a dose if it is determined your cat no longer requires a steroid. Here's my personal approach. I try everything else first. I exhaust other diagnostic testing and treatment options before I reach for a steroid. And I make sure my clients fully understand the risks and benefits from the beginning before I begin a steroid treatment. That way, if a side effect does occur, we know we made an informed decision, we tried other treatment options, and we determined that steroids was the best choice for that cat. Steroids can be life-saving. Rarely they can be life-altering in not so great ways. The key is to pick the correct patient, the right dose, and continue monitoring while on the steroid. And if your cat is on a steroid, make sure you are giving prednisolone, not prednisone. If you enjoyed this video, make sure you like, subscribe, and comment. Thanks so much for watching, and I will see you on my next video.